you to Dr. Cymr for inviting us today, so thank you very much. So good afternoon everyone, my name is Roach and this is my colleague Jules, Godden. We lead the education programmes for patients. It's more widely known as EPP Cymru. So, what is EPP Cymru? So it was launched back in 2003 as the Expert Patient Programme, providing a small range of self-management courses for people living with long-term health conditions and also carers. Today, we offer multiple courses that aim to empower individuals to effectively self-manage, embrace those healthier lifestyles, and make informed decisions about their health and their health care. So it's a programme of patient empowerment and self-efficacy. All our courses are developed and co-produced in collaboration with patients and healthcare professionals, and sometimes various partner organisations. We base most of our development on the Stanford Model Framework, which provides a robust structure and proven methodology. So this slide outlines our operating model. So on the left-hand side, you'll see the responsibilities of the EPP national team, where Jules and I sit. So these include the development of new chronic disease programmes alongside the delivery of an annual national training programme. And through this programme, individuals are trained to become accredited facilitators for specific chronic condition areas. And then once trained, facilitators can co-deliver programmes within their local communities alongside experienced facilitators. This delivery model is supported by a robust quality management system which ensures accreditation standards, provides ongoing facilitator development through annual upskilling, and maintains consistent standard operating procedures across Wales. On the right-hand side, you'll see where local EPP health board teams who are responsible for operational delivery at community level, and this includes managing and supporting volunteers, coordinating local promotion and marketing activity, and then overseeing the delivery and the support of programmes within their areas. So this shows the courses offered under our business as usual. These courses range from a one-off session to 8 sessions, and as you can see, we've got a stand here today, so please come and see us for more information on the courses. And then coming soon, you can see at the bottom, in our annual work plan this year, we've added HIV, dementia, MS, bronchiectasis, and of course, osteoporosis. And these will be added to our business as usual work plan and offered as part of our national portfolio. Jules.
Hi everyone, thanks Chris. So what was it that we did? So we collaborated with the amazing Dr. Cymr and also people who have lived experience to develop a clinically informed and most importantly patient-centred educational programme for people living with osteoporosis. This was a structured 6-week course. We started running the pilots, the first of which we delivered at Ysbyty Ysbyty, not easy for me to say, I'm not going to lie, and we had 18 participants attend. So lived experience, as we said, is embedded across all of our programmes. And as someone living with osteoporosis, as they sneaked me in early, you might have seen that, I was able to contribute directly to not only the design, but also the delivery of the programme. Behind me, you'll see a couple of images there. The image on the far side of the slide is one of our initial cohorts of participants that came along to one of our pilots. Every week we invited them to share what went well, what could be better, and what their takeaway was from each session, and we took that information so that we could constantly build a programme. Also, if you look onto your right-hand side then, you'll see a form then that we've blown up. And this demonstrated how that participant feedback was used to inform those improvements. We made refinements from what was suggested, and then we implemented these on each pilot that we delivered. And some of the things on there you can see, I know a lot of people come and spoke to me at the desk, but looking at increased vitamin D intake of We incorporated a chair yoga session with breathing to help with relaxation and reduce that fear of falls, which was one of the really big issues that came across. And then we've completed now 3 pilots. I don't have the finished data because it literally finished on Tuesday this week. But we will compile that data, and please just leave your address on the table for me and I'll share that with you as soon as we have it next week. Once that's done, we'll be scaling and spreading this across Wales, so wherever you are in Wales, you'll be able to access these courses. So, what are the benefits? So, the benefits included patient confidence, also symptom control. And whilst being supported by the NHS, there was a reduce in service pressures. There was also promoting that healthier Wales. So we know the programme is cost effective because we're using trained volunteers, those living with lived experience that are able to be empathetic, and these are delivering community-based support alongside a patient-focused empowerment programme. And also that's working along with that preventative care model. So I'm going to introduce you now to Cymr. Cymr's here, hiding at the back of the room. Cymr is a retired civil servant who participated on one of our pilot courses and also attended our peer support service. So I'm going to hand you over to Cymr. Fingers crossed.
Hi, my name's Cymr Williamson, and I wanted to share with you that after so many years of finding my own way in trying to manage my condition of osteoporosis, I was invited to attend the Living Well with Osteoporosis pilot call. It's been a life changer. The sessions were short with brilliant trainers, full of information and learning. But it was really in that safe space to discuss the best ways to manage our conditions, with often very little knowledge before we actually attended, in that we could then support each other each week to do that little bit more. I urge every health board to adopt this programme, as there would be so many patients that have been diagnosed with osteoporosis that would benefit from these sessions. Think of it as a pathway of keeping patients like me out of your A&E departments, with ways in which we can manage our condition, which absolutely cannot be just through medication. This is also why I now want to play my part in supporting others with osteoporosis and support the team in delivering these courses in my own local community. What's there not to love? Thank you for listening.
Cheers, Kim. Okay. Probably deserves a bit of a round of applause on that, to be fair. Okay, so as Kim said, she came on one of our courses. She has now is going to go forward to train to be able to go back out and give that back by being a volunteer and delivering that course to support patients living with osteoporosis in her community. Also, she's going to support us with our support service, which was something that we did as part of the Bevan Exemplar programme last year. So I just want to touch briefly on how EPP works. These were lots of questions that I had this morning. So firstly, I want to talk about our delivery model. So the courses are run online and they're also run in community settings. The ratio is around 50-50. It varies per area, but it's about that level. And as mentioned, we deliver peer-led courses by trained facilitators, and these are run by staff and also volunteers. So the referral process is very straightforward. You can refer or you can self-refer. There is an active QR code which you can use, or you can simply go to our website, EPP Cymru, and you'll find us quite simply. All you need to do if you're a patient is to put in your postcode. That postcode then will direct you straight to your coordinator who can assist you with information at local level. We also have worked in collaboration with both the voluntary sector and NHS services, and an example of this is that we are working together with the Tackling Diabetes Together team in PHW to deliver 2 peer support sessions to support patients living with diabetes, and that's going to be in the next financial year. So earlier we touched on the Bevan Exemplar project, which was a national peer support service to patients who have completed a 6-week EPP course. So following that, early outcomes showed that there were reduced unnecessary appointments, There were more proactive self-management behaviours taking place, such as increased vitamin D intake, improved diet, and also improved knowledge-based exercise. Patients also said that they felt more connected, they felt more empowered, and also we had reports back from health boards reporting better management and also patients making earlier interventions. So the programme supports a shift to a more sustainable, community-driven care, and this enhances well-being, strengthens social networks, and also aligns with the Welsh Government priorities on prevention and also resilience. So finally, I just want to say thank you very much for listening. And you can see on the slide a couple of comments from our osteoporosis courses. We thought we wouldn't put them all on because they'd be a bit cluttered, but I have multiple amounts of these. Our addresses are up there. We're on the stand. Anybody wants any more information, please come and see us because we're always grateful to have a chat. So thank you.